Wow, what did you think of that session about agency? For me, it's essential to feel in control of, my own life and my own choices.
Yeah, definitely agree, De Graaf.
Yeah.
I was really interested in the session about the first ever United States National Adolescent Health Action Plan. It could really be a promising practice for other countries to consider and to look at as we embark on this journey to promote adolescent health, well-being, and development.
100%.
So now to our next core sessions. If you've ever come across bullying, and sadly, most of us have, you'll know what a devastating effect it can have on your and our collective lives. This core session might be for you. It's called We Deserve Better, from combating violence to fostering safe spaces. Alternatively, you might want to get involved with this one, also absolutely vital. It's called Adding It Up, Evidence to Impact, making the case for adolescents' sexual and reproductive health and rights. As we all know, data is power, and this session highlights how data is being used by young people to improve adolescent health services across 130 countries. I'll be joining that one.
Of course, we are spoiled for choice today. And as we're talking about data, you might know about the wonderful Apurva Panidapu, aka the human calculator. Now, she is a proper genius, but not just with figures. She's a massive thought leader on topics like work and how employers need to understand the values of the young workforce. Plus, we've got interesting partner content. The day is nearly done, folks. We'll see you after the next sessions.
Unite! Rise! Lead!
Hi, I'm Apurva Panidapu, and I'm so excited to be joining you at the first ever Global Forum for Adolescents. It's so inspiring that over 1 million young people have engaged in the 1.8 billion Young People for Change campaign, including through the What Young People Want survey. These voices are the springboard for all the amazing conversations, dialogues, and creative and innovative activities that we're enjoying across these 2 packed days. It doesn't surprise me at all that the results of the historic What Young People Want survey show that one of the leading priorities for young people right now is finding work that they feel inspired by. We are constantly talking about diversity in the workplace, and often we think that's about race, gender, ethnicity, and it is, but it's also about age. Not only are we the 1.8 billion strong young generation, the biggest in history, we are also the first generation to be digital natives. We are a generation which wants to feel passionate about the work which we do. But workplace leaders don't currently understand how to attract young talent and, more importantly, retain them. I believe that leaders and corporations need to reimagine workplaces so that they appeal to our generational values in this digital age. Values like sustainability, social responsibility, and diversity, equity, and inclusion. It's time for leaders to listen to us, to understand and adapt the workplace in order to engage us, the next generation of thinkers, the I.8 generation. And they must adapt quickly to be ahead of the game and to be at the forefront of the future of work, innovation, and creativity. We know the incredible potential of growing our work online and how young people can engage with virtual platforms to create, grow, and develop businesses and their own personal passions. Moving forward, we need to address gender bias in technology and education and enable all students to engage in this digital age. It's time to welcome learning transferable real-world skills like the ability to pivot in order to give meaning to learning and to boost motivation. Let's make sure we don't hold back the talent of our generation while waiting to arrive at the problems of tomorrow. Instead, let's enable all young people to be actively learning and working on the problems of today so that we can fix them now. Here's to Gen Z.
Hello everyone, I'm Danielle, and I'm here to share with you new evidence that shows exactly why we need more attention and more investment in adolescent well-being. Now, we all know that campaigning needs strong facts to back up our voices. So now, for the first time, the BMJ, a leading academic journal, has released the first of a 2-part collection on adolescent well-being. The best bit is that young people's views are at the heart of the series, so let's say hello to my fellow incredible young researchers who took part in this important work.
Hello, everyone.
Now, we asked for your questions on this series and put them to our young research team.
It is understood that every government has to balance what they spend their money on. However, we do know that for every $1 spent on adolescent well-being, there's a return of $5 to $12 because if young people are healthy, educated, and have access to opportunities, they are much more likely to contribute positively to society. In this vein, governments can not only save money, but can also yield higher returns on their investment by making the decision to invest in young people today. That being said, it is necessary to note that the most important reason for investing in adolescent well-being is that this is their basic human rights. And as such, it is the duty of governments to plan for, support, and address adolescent well-being.
There are 5 domains of well-being that mattered to young people. Number 1, good health and nutrition. Between 2003 and 2015, adolescents accounted for 11% of the global burden of disease, but they actually only received 1.6% in terms of development assistance. We are calling for more financial investments for young people. Number 2, connectedness and community. Having a sense of belonging, good social, mental, and emotional support was linked to better health outcomes. We're calling to strengthen community and connectedness for youth worldwide. Number 3, safety and support. In 2018, 1 in every 3 girls between the ages of 15 and 19 suffered from a form of physical, sexual, or emotional abuse from an intimate partner. Unfortunately, we know that the pandemic made this much worse. We're calling for a safe environment, free from harm and violence, so we can live a life free from fear. Number 4, education and employment. Globally, 1 in 5 young people between the ages of 15 and 24 is not in employment, education, or training. Unfortunately, this is twice as likely to affect young women than young men. We're calling for all young people around the world to have access to school or training, especially girls and women, so that we can be financially independent, have control over our futures, and contribute to our communities. And finally, number 5, agency and resilience. We know our needs and rights, and we know how to advocate for them. We also know that what gets measured gets counted. So we are calling for stronger systems for accountability to measure progress, and platforms for our voices to be heard.
The Adolescent Wellbeing BMJ collection was co-written by young people, which is pretty key given that the collection built on technical papers to promote adolescent well-being. It was particularly important to have voices from the Global South because all too often research is produced in the absence of these voices. Beyond being involved in the writing itself, young people were consulted to determine the priority themes or domains of a BMJ collection. All in all, young researchers had the opportunity to share their expertise about issues that matter to them.
Climate change is already affecting our lives, putting at risk our physical and mental health and well-being, and exactly how it does so is covered throughout the series. We also focus on how health communities are in a unique position to tackle climate change, such as through evidence generation, net zero healthcare efforts, but also crucially by collaborating with adolescents on advocacy on how climate change is impacting their well-being.
Thank you, fellow researchers. The series has been 18 months in the making, and we are so delighted to be launching it now, especially because we know there's a force for change right here with us. So, whether you're speaking with your head teacher, member of parliament, or president, we hope you can use this evidence to campaign for adolescent well being. We can't wait to hear how this is being used, so let us know. There's so much more information on the campaign platform at 1.8.org. Thank you.
Unite! Unite! Rise! Rise! Lead! Lead! Young people, this is our time.
Hi everyone, good to have you here. Welcome, welcome. I'm going to give it a minute for us to see if we can have other people join us, and then we'll start. Okay, thank you, thank you. The timer is not moving. Okay, hi everyone. Welcome. Welcome to this session organized by Guttmacher Institute at the Global Forum for Adolescents. Today we'll be focusing on evidence-based advocacy approaches by and for young people to prioritize adolescent sexual and reproductive health. My name is Lilibet Namakula. I'll be our moderator for today. My day-to-day job is I'm the team leader at Public Health Ambassadors Uganda. Public Health Ambassadors Uganda is a youth-led and a youth-serving organization, and we focus on issues of sexual and reproductive health, HIV, youth empowerment programs, health education, social enterprise, and everything good and everything important for adolescents and young people. I'm happy to have all of us here. We are excited about this session because we're going to preview new findings from the Guttmacher Institute. And this is going to concentrate on the costs and benefits of investing in sexual and reproductive health services, especially for adolescents, and especially looking at contraceptive services. So another thing that makes this session unique is that we're going to hear from 3 youth-led groups about how they have previously used this sort of evidence to successfully advocate for stronger adolescent sexual and reproductive health policies and programs, both at the national and local levels. We're not just picking from one point of the world. We have organized these groups from different parts of the world. So we have the YP Foundation in India, we have the TaYa in Ethiopia, and we have the IYAFP, which works in many parts of the world. So they're all across the world, but we have one common vision: sexual and reproductive health and rights for all young people. So you'll be able to see their full names and bios in the platform, but also we'll be able to hear from you through a poll in a little while. So please don't leave it up to us. We would like to hear your opinion. We'd like to hear what work you're doing. So share with us everything And prepare your questions in advance because we'll be taking questions at the end. Okay, so now I would like for us to go straight into our first presentation or first panelist. And the first one will be Beth Sally from the Guttmacher Institute. Beth Sally is going to share some new evidence on the costs and benefits of investing in providing adolescents with the contraceptive services that they need. Beth, take it away.
Thank you, Lilibet. My name is Beth Selly, and I'm a principal research scientist at the Guttmacher Institute. I'm excited to join you all today to preview our latest evidence from Adding It Up 2023 on the sexual and reproductive health and rights of adolescents. Next slide, please. In this brief presentation, I'm going to show the need, impact, and cost of providing essential contraceptive services to adolescent women ages 15 to 19 in 130 low and middle income countries. I'll present our exciting new results on the immense impact that could be achieved by investing in contraceptive services for adolescent women, what it costs to provide these services at internationally defined standards of care, and the additional investment that is required to meet all of adolescents' need. These are a preview of findings that are going to be released in early 2024 that will document a much broader range of sexual and reproductive health service needs among adolescents. Together, these are services that can ensure adolescents can decide whether and when to have children, to experience safe pregnancy and delivery, to have healthy newborns, and to have a safe and satisfying sexual life. I'm going to focus today on the global level for all low and middle income countries together, but later next year, all of the country data that's similar to what I'll present today will be available. Let's dive in. Next slide, please. So in 2023, 34 million adolescent women in low and middle income countries wanted to avoid a pregnancy. Among them, 41%, or 14 million, had an unmet need for modern contraceptive methods. That means they were either not using any method of contraception or were using a traditional method. The unmet need among adolescents is almost 2 times higher than it is among all women of reproductive age. Next slide, please. There are also wide disparities in unmet need for modern methods among adolescents across countries. 57% of adolescents in low-income countries, that's the bar you can see on the far left, have an unmet need for modern contraception, compared to only 22% in upper-income countries in the far right bar. Next slide, please. When we look in more detail, we can see that among the 41% of adolescents in low and middle income countries with an unmet need for modern contraception, so this is the orange bar that you see on the right of the screen, among them 7% are actually using a traditional method of contraception. However, 34% are using no method at all. The 59% of adolescents that do have their contraceptive needs met, so that's the teal bar on the left-hand side, among them, we can see that the majority are using short-acting methods, with condoms followed by pills, patches, and rings being the most commonly used methods among adolescents. Next slide, please. With almost 2/3 of adolescents using modern methods relying on short-acting methods, it's not surprising that the private sector actually plays a really critical role in meeting adolescents' contraceptive care needs. The data here presented are for 36 low and middle income countries where survey data is available on the source where adolescents obtain their contraceptive method. On the top graph, you can see that 45% of adolescents got their method from a non-public source, so that's the lighter blue bar, which is just slightly more than among all women of reproductive age. However, when you look just among adolescents by the methods they were using, the bottom 2 bars on this graph, you can see that adolescents using long-acting methods rely heavily on the public sector as their main source of contraceptive care, while adolescents who are using short-acting contraceptive methods are going quite frequently to the private sector as their point of care. Next slide, please. When there are gaps in meeting adolescents' contraceptive needs, we know this increases the risk of unintended pregnancy. Among the 20 million pregnancies among adolescents in low and middle income countries each year, 9.7 million of them are unintended, and 5.2 million end in abortions, most of which are unsafe. Next slide. If all unmet need for modern contraceptive care were met in low and middle income countries for adolescents, there would be declines of 61% among unintended pregnancies. So this means a drop from 9.7 million unintended pregnancies each year down to 3.8 million. And we would see changes too in the outcomes of these unintended pregnancies. Unplanned births would drop from 3.3 million to 1.2 million. Unsafe abortions would drop from 3.4 million to 1.3 million. And miscarriages and stillbirths would drop from 1.1 million to under 500,000. Next slide, please. It currently costs $449 million annually to meet adolescents' contraceptive need for services in low and middle income countries. If all adolescents' needs were to be met, this would require an additional investment of $602 million annually, resulting in a total cost of $1 billion each year to meet adolescents' contraceptive needs in low and middle income countries. This includes the costs of contraceptive commodities, the health staff time to provide care, and the larger health systems costs necessary to support contraceptive services, such as training and infrastructure. Next slide, please. Here you can see the breakdown of where that additional investment of $602 million is needed across subregions, where the greatest investments are necessary in sub-Saharan Africa, in Southern Asia, and in South America. Next slide, please. We're giving today just a short preview of our new Adolescent Adding It Up 2023 findings, and I invite you to come join us next year and check out the full set of results that we'll be sharing, as well as country-level data. This will include a larger package of services, country data on the need, impact, and cost, and other tools to really support adolescents in advocating for their essential right to sexual and reproductive health services. And with that, I want to turn it over to the experts and the advocates who are really leading the way with this. I'll hand it back to Lilibet, and I'm really excited with the conversation with you all today. Thank you.
Thank you, Beth. Beth has painted the picture. The data is there, the need is there. Now we want to hear from the different people that have actually been using this data and what it has done for the different young people that are across the world. So next we'll move on to Peace. Peace is from IYAFP, and she's going to be talking to us for a few minutes just to share. And Peace, I would like to ask you, how have you used the evidence from Adding It Up in the past, and how has it been influential in the work that you're doing? Over to you, Peace.
Thank you so much for your question. From what has been shared, IYAFP used adding up data in the past to conduct advocacy to various countries across Africa. So we conducted advocacies in Rwanda, Albania, and in Malawi, but because of time and for the sake of context, I will just focus on what we did in Malawi. So in Malawi, we advocated for determination of the pregnancy bill 2021 to be passed, and that bill would have reduced the restriction to access of abortion, safe abortion care, and services. So what we did was to go into the communities and speak to students, university students. We spoke to and we were able to conduct advocacy on that level. So we spoke to young people. We were able to educate them on the importance of safe abortion services, and we were also able to speak to some members of the parliament where we advocated also on the importance of safe abortion services and how it would make the health of young women improve. We were also able to perform social media campaigns. We shared data from this research, and adolescents and young people were able to use that data to advocate for their own health. from what we did, we were able to generate movement. In as much as the bill was not passed, we were able to generate movement with young people. So we built a movement with other youth-led organizations that were in Malawi, waiting for safe abortion healthcare services too. Another thing we are able to do was to push for safe abortion in the social media space. So the terms safe abortion became more public. People were able to discuss more about it. We were able to share ideas, share knowledge on the internet. We were also able to engage young people because of data. So we had this evidence and data. Young people were able to also advocate for their own rights. They were able to share findings. They were able to, put it out on platforms and see the importance of this information and how it can help them to ensure that their SRH and rights are achieved. So this was how we used this data in Malawi. So thank you, Beth.
Okay, thank you, Peace. I think you have shared how it looks like to have information that is not only supporting young people in one country, but three. From the lessons that we have picked up from Malawi, as you have shared, it's important to use different platforms and to give young people an avenue for them to also speak for themselves, to be able to reach out to the decision makers. Okay, so next let's talk to Semaria. Semaria, which of the components of the Adding It Up findings are particularly compelling in your advocacy work?
Okay. Hi, everyone. My name is Samaria Nagash from TaYa, formerly known as Talent Use Association. So, one of the most compelling evidence on adding it up is the unmet need for modern contraception is higher among adolescent women than the ones that are unmarried and sexually active. So as TaYa, we developed fact sheets, we organized dialogues, workshops, and posted on our different social media platforms that brought young people, CSOs, Ministry of Health, and different stakeholders. And we used the research from Guttmacher Institute together with the data to tailor the message and get more resonance. So it has been really influential in the development of the adolescent and youth health strategy, which is such a huge achievement for Ethiopia. It's a national strategy that that thinks that puts in place that the youth-friendly health services should be mandatory, that it puts better budgeting for advocacy and health services, and also it's now better and improved now that youth-friendly health services are easily accessible to young people. And we also always advocate for sexual and reproductive health information and education for young people, and also youth-friendly services in all health centers and hospitals young people find nearby. So in order to do this, I think that adding it up evidence has been really helpful in creating reasonable doubts whenever we advocate and whenever we ask for what has to be done. So I believe it has been really helpful. Thank you.
Wow, thank you, Samaria. I think you've also pointed out the essence of having multiple partners working towards one aim. We have seen how it has brought out the national strategy that you've talked about, and that is not something that can be achieved as an individual. Okay, so we've heard from two of our speakers. I'm interested to find out what our audience is thinking. We're going to have a quick poll question for the audience. Before we move on to our last panelists, we want to hear from you. So we would like you to answer the following question. It's supposed to be on your screen. So the question is, which advocacy method is the most important for promoting adolescent sexual and reproductive health? Remember that you can only give one response, but I want you to pick out from the many that you know. Could you pick out one from your experience? What do you think in your opinion, is the most important when it comes to promoting adolescent sexual and reproductive health? Would like to hear from you. We know that you're all experts in your own fields and your own capacities. So it's important to hear from you as well. So while the poll is running, I'll give it just half a minute for us to put in our answers real quick and take this time to also contemplate and think about the what the previous speakers have shared, what Beth shared in her presentation. What are some of the things that you have picked up? What are some of the things that you use in your day-to-day advocacy work? What is it that you use in your programming? What have you seen for yourself? Every experience is a valuable experience. So it would be important. We would love it if you shared with us. Um, I think I've done enough talking, and I think you guys have had enough time to look at the poll and give me your one answer. I hope it's the very best one. Don't save the second, don't give me the second best one. Give me the best one so we can have a look. Okay, so we'll come back to getting the results of the poll right after we get to our fourth speaker, who is Prina. Prina is from YP Foundation in India. And so, Prina, I would like to ask you, what are some of the challenges you face when advocating for sexual and reproductive health for adolescents? And how have you been able to address them?
Hi. So there have been multiple challenges in Indian context, but we realize that the lack of awareness is majorly because talking about SRHR is still a major taboo. While working on the adding it up research, we also realized that we already have existing legal framework which covers SRHR for adolescents, but it is not being implemented or executed. There is a national adolescents health program specifically designed for the health and well-being of adolescents, but people are unaware about it. So then we onboarded a few adolescent and youth advocates from different states in India, and decided to get adolescents and policymaker on one platform and discuss their needs and ask from each other, which resulting to the policymakers committing to work on the execution. And they also reached out to different community engaging NGOs to help them with the execution of the policy. And yeah, that was one of the major experiences I wanted to share.
Wow. Thank you, Prina. It's interesting to hear that some of the challenges that you're facing in Uganda are very much similar to the challenges that we're also facing in Uganda as a country. So it presents to us that the challenges are many, but the solutions are multiple. You know, um, they just need to be designed to the communities that we're serving. So thank you for that. So let's hear back from the poll. The question was, which advocacy method do you think is the most important for promoting adolescent sexual and reproductive health? It's interesting to see that we have a tie for the lead. The first one, the first answer is dialogues bringing advocates and policymakers together. That scored 37%. We had a tie for first position with training other youth to advocate for sexual and reproductive health and rights. And then in second position, we had media outreaches, both traditional media, that's considering both traditional media and social media. And then lastly, we looked at direct engagement with policymakers. So I thank my audience for sharing with me. I think that um, all of these are vital they're all vital solutions. They're all methods that can be utilized in the right communities and in the right spaces. Um, it's also interesting to hear what works best for you as an audience. So I appreciate you all for sharing. Um, so now we're going to move back to our speakers. In 2 minutes for each of our speakers, we're going to have one question. This question is, what is one key way to engage young people in advocacy and help build a movement for adolescent sexual and reproductive health? From the poll that we have had, we have seen that actually engaging young people, and from the experiences that have been there, engaging young people is something that is vital. So for my speakers, just 2 minutes, tell me, what is one key way to engage young people in advocacy and to also build a movement of adolescent sexual and reproductive health? We'll start with Peace.
Thank you, Lilibet. I don't know if I can give one, because there are multiple ways to engage young people, but I would say in a summary, it would be education and empowerment, and this would happen when we when we allow young people to take the lead, when we let young people take the lead. Young people are leaders. Young people know what they want. They have an agenda. We have to, step back and allow them to lead. Another way we can also support young people is by providing technical, either through data, either through finances, just looking for ways that we can support their advocacies. In that way, we are also not just helping them, but we are building a movement around SRHR. And another thing I'd like to share would be partnership, would be true meaningful partnerships. Young people um also engage with partners, with donors, with people that will push for SRHR in their community. So partnership with them would also be a good way to promote SRHR advocacy for young people, and it will also help us to achieve better results. So yeah, thank you, Lilibet.
Thank you, Peace. So Maria, tell me, what is one key way to
Um,
engage young people in advocacy?
So I believe one key way to engage young people in advocacy and help them build movements is the meaningful and inclusive youth participation of young people during the research process. For them to participate meaningfully, to contribute, and they can help participate in identifying priority research questions, uh, help interpret findings, and also reach out to the respondents and identify who can respond to the research questions because they know better, they can empathize better, they can see better of what they're going through, they know their struggles better. I think we know what young people are what's going on among young people, and even if it's not happening among us, we can empathize. So I think young people should participate meaningfully in the research process and contribute, and I believe that they can contribute a lot, and it can also help them build their capacities and contribute in other different researches. So uh, I think we should meaningfully participate and also in an inclusive way. Thank you.
Fantastic. Thank you. Lastly, let's hear from Prina. Prina, what is one key way to engage young people in advocacy and help build a movement of adolescent sexual and reproductive health?
Uh, Thank you, Lilibet. So I would like to add, well, I was really happy to see the results of the poll, which was sort of validating for us, because what currently which we are trying in India is something similar to build dialogue. So while we were doing our state level convenings for the research, we realized that it is very important uh, to have a adolescent and youth advocacy group to work on it continuously and do regular follow-ups with the policymakers and keep doing the work and not lose the spirit. So we have formed a policy working group in India, specifically working on SRHR and also on policies. Uh, it like the members of this group are from all majority from all the states, and we have also adolescent representatives from almost all the states, and few of them are also representing India at platforms like 1.8 billion campaign for change. So I think that's the one thing which we are trying to do. So I don't know if how much of it is the best answer to it, but yeah, this is a movement which is trying different things and coming together.
Wow, thank you. Okay, so from the question that I've asked, I personally, as Lilibet, have picked up 5 beautiful points. The first one being education and empowerment. The second one being young people are leaders and should be considered as valuable partners. The second one is it is vital to have partnerships with young people. The fourth is meaningful involvement, emphasis being on meaningful. Meaningful involvement and participation of young people is key. And lastly, young people do not live in a vacuum. So we need to be able to involve and work with decision makers and leaders. So I thank my speakers for taking the time to answer that very important question. While they were talking, the poll adjusted. So remember our question? Our question was, which advocacy methods do you think are the most useful for promoting adolescent sexual and reproductive health? The one in first position as we speak is training other youth to advocate for sexual and reproductive health and rights. That's our number one answer. Our number two answer is dialogues. Our number one answer was at 42%. Our number two answer is at 34%, and it says dialogues bringing advocates and policymakers together. Our number three answer is media outreaches, utilizing both traditional and social media. And our number four answer is direct engagement with policymakers. I thank you for taking the time to review the poll questions. And now I asked you a question, but do we have some questions for the speakers? Do you guys have some questions for us? And we're going to, I encourage you to write them down in the chat so that we can have the speakers review them and give you some answers from their perspective, from the work that they have done, from everything that we've shared today. Let me see. I can see a question. So one of the questions is, what are some of the main gaps in policy implementation for adolescent sexual and reproductive health in your country? This is a very broad question. And we have people from different countries. So let's see if we can get an answer from each of the speakers. This time I'll switch it up. Let's start with Prina. Prina, what are some of the main gaps in policy implementation for adolescent sexual and reproductive health in your country?
Yeah, hi. So one of the major gaps which we realized and we observed is uh, lack of resources, like especially monetary as well, and it is a vicious cycle actually. When you go to the policymakers and ask them ki why it is not being done, so they say that people don't come to avail these services. so we can't allot specific people to work on it. And if we go to the people who are actually going to use these services, they are unaware of it, and they don't know what to do. They don't even know that there is something like that existing for them, and they can take the benefits out of it. So these are two major reasons. SRHR being a taboo topic, so that the adolescents and the parents don't talk to their children about it, and other is lack of resources, uh,
Mm.
especially at a monetary level. So yeah, I
Wow,
like to pass
fantastic.
it to.
Okay. Thank you, Prina. How about let's hear from Samaria. Samaria, the question is, what are some of the main gaps in policy implementation for adolescent sexual and reproductive health in your country?
Okay, so I think I'll agree with what Prina has said earlier, because as sexual and reproductive health topics are usually considered taboo, so the policymakers themselves, the influential people, really don't believe in them for them to implement them. It's just on the books. So there is a betterment, there is improvement. Like I mentioned earlier, there's the adolescent and youth health strategy, but it is still on the books. But there's better budgeting, but there's still not proper and equitable services being given in health centers and youth centers we find nearby for young people. So young people, if they go to health centers, at some health centers, they might get the right services. At some, they might not. At some, they might just be told the Adolescent and Youth Health Service Center is used for something else. So there's still gap in implementation, but we're still thankful that there are strategies and policies that are on books, but we have to advocate more to implement them. Thank you.
Thank you. Thank you. Peace. We would like to hear from you now. Should I repeat the
Um,
question?
no, it's fine. I got the question. Some of the gaps that we face in our various countries. So I'm from Nigeria, and we have quite a number of gaps, but one that I would like to talk about would be the provider bias. So, in as much as there are policies there, or access to contraceptives, you can walk into a healthcare facility or anywhere to get these services. You can go there, but it now depends on the person who is providing the services to you. So, we still have that bias in Nigeria, where you to the healthcare facility and the provider is like, why are you here for a contraceptive? How old are you? You don't need one. Why are you sexually active? So there is that bias, and I think because of culture, because of the whole culturally attached notion to it. So that bias is there, and young people face challenge in accessing contraceptives. So they feel like they're going to get judged, and there is no need for them to go to the healthcare to access these services. But the good thing now is that we are seeing a lot of trainings going on in healthcare centers. We see partnership with government and donors who are coming in and saying that no, young people matter, and they can access services whenever they want to. So there is now a reorientation to providers to actually treat young people the way they will actually treat adults working in to get a contraceptive service. So yes.
Hmm. Wow. You know what's funny? It's interesting to hear that the answers are very similar to Ugandan
Mm-hmm.
problems. So, it's very similar that the problems are the challenges are the same. But it's also
Mm.
interesting to hear that the solutions are varying. They're very innovative. We're trying everything and anything to be able to help young people be able to access the services that they need. And not just any services, but quality services, because that is the key. I could go to a health facility and get what I need, but also be judged 100% of the time doing it. So where can a young person go and receive what the services that they need and not be judged for it and receive the very best in a timely manner and all that. So I appreciate all the answers. There's also a question from, I can't read that name. I'm sorry. Yabsira. Yabsira. I'm sorry if I bought your name, but Yabsira, I'll try. Yabsira is asking, what strategies have you used to advocate for SRHR in a very religious country? Who wants to take that question? Who would like to take that question?
I think
Peace.
I can go first.
Yeah.
So, one of the strategies that we use here in Nigeria, because we are deeply religious in Nigeria, so we have the Muslim religion, we have the Christianity religion in Nigeria. So we approach this by working with gatekeepers in the communities, and the gatekeepers in these communities could be the religious leader, for instance. So we go to them, and we do not call it sexual and reproductive health per se. We can say family life education, so that way you're not coming to spoil their children, in quotes, because that's what they call it. So we are coming to educate them on family life, and we are coming to tell them how to be better in their family health if they want to get married, so it's just to find a way to work with the community leaders and the religious leaders in a perspective that they would understand, and in a way that also young people would benefit from it.
I mean,
Yes.
that is a very good answer. Packaging always matters. The moment you go in all violent with heavy words, they'll be like, no, thank
I
you.
know.
Okay. Okay, so we have another question from Melvin. Melvin is asking, how were the dialogues with policymakers like, especially regarding your advocacy on sexual and reproductive health? If there was resistance and disapproval at first, has there been any significant change in their views along the way? Very long question, but in essence, he's asking, in terms of utilizing dialogues to reach out to policymakers, what are some of the what are some of the challenges? What are the solutions? Does it work? That's what I'm picking up from this question. I think I can take this to Prina. Prina, could you answer Melvin's question?
Uh, yeah, so there have been a resistance initially, but what has always worked with us and what we have seen is when you uh, put the policymakers in front of the direct beneficiaries. So if adolescents directly ask them questions that why are we unable to avail these services, I think that becomes a huge impact, and it puts them in a situation. And yes, we have seen change in a long way. It's been 2 3 years now that our policy working group has been working, and we have seen changes at least from two states. I can share specifically that the policymakers have now, like, at regular intervals they engage with us, and they take our suggestions and reach out to us for what help, whatever they feel that they need to change. So
Hmm.
yes, it's a long journey, but I think bringing that dialogue and making the direct beneficiaries aware and questioning the policymakers makes a huge difference.
Yeah. Thank you. Thank you, Prina. I think your answer is very suitable. Advocacy is a very, very long journey, but we pick off the easiest fruits that we can along the way. Secondly, persistence breaks resistance. So the more you do it, they will eventually hear you. And the last one, try. That is advocacy in a nutshell. There's no quick answer, but we celebrate the quick wins along the way. Okay, so there's another question that has come up. And the question is, there is a big social legal problem. There's a big social legal gap. I'm sorry. There's a big social legal gap between sexual and reproductive health policies and how they are translated into practice. How can we utilize evidence-based research to bridge this gap? I think this question is perfect for Beth. Beth, give us an answer.
I mean, I think this is where designing research studies specifically to call that out, to collect the data, to show, this is what your policy says, but here's what's happening on the ground. And that can be used to really hold governments accountable for the improper implementation of policy. We did a study about 5 years ago now on comprehensive sexuality education and looked, what does the policy say? Then interviewed the teachers and said, what are you teaching in your classroom? And then we interviewed the students and we said, what are you learning in your classroom? And looked at the gaps all along the way from what was on the books to what the teachers were really doing to then what the students said they actually were told, which is different from what the teachers said. And that was work in Kenya and Ghana and Peru and in Guatemala. And that led to changes in a number of those countries of actual shifts in the implementation and in the policies themselves. And so I think that's where research can really shed light. You guys, I think you hear on the ground when it's not being implemented correctly. And if we can collect that data and show it and bring that together with the power of these youth advocacy strategies, that can, I think, really push for change and ensuring correct implementation.
Yeah. Thank you, Beth. I don't know. I'm hearing everything Uganda. Similar but different. So I'm sorry. I really appreciate this. This is also a learning moment for me. The beauty about such conversations, it's not about one person and it's not just about one area of the world. It's about adolescents and the challenges and how we can make it better. So it's a broad topic that we can only bite on and chew a little bit. Okay, so we only have a few minutes left, and I'm going to just ask one question that was among the first ones that popped up. And it just asked that could the panelists, could the speakers share what their answer to the poll question would be? The question, to remind you, is which advocacy method do you think is the most useful or the most important for promoting adolescent sexual and reproductive health? The first one being dialogues, the second one being direct engagement with policymakers, the third one being media outreaches, and the fourth one being training young people as advocates. I'm going to get an answer from each of you. One answer, don't explain it. Give me what your answer is, because the participants didn't have explanations. Just pick your answer. And if you want me to go through the answers again, I can. The options. We'll start with Semaria.
I'll obviously go for training young people to be advocates for sexual and reproductive health.
Fantastic. And then let's hear from Prina.
I'll also go with Samara on this, training the young people to be their advocates for themselves.
Okay. Beth, what do you think?
I'm gonna have to stick with their answer because I'm not gonna conflict with the experts' views on this. I trust them; they're the experts.
Okay, Peace. What do you think? What's your answer to the poll question? Oh, you're muted.
I would say my answer to the question. Okay, I would say my answer to the question would be training other youth so that they can also advance their rights. Yeah, the last
Oh, I'm
option.
telling you. Speakers, did you have a meeting before this? Because we didn't agree on this. No, but it's interesting to see that we all agree the solution is held in the hands of the young people. We have to be able to train them to be able to speak for themselves, to front their challenges, to get the solutions that they want. So I appreciate you speakers for taking the time, but also I do want to appreciate our audience for being here with us. We have gotten some valuable insights from the different panelists from different parts of the world. We have seen different advocacy approaches that are all using the Guttmacher Institute's Adding It Up data. So we hope that other youth organizations and other participants can be able to benefit from the stories and examples they have shared. And please stay tuned in for the full release of the new Adding It Up data in the early 2024. We appreciate you all and we wish you a lovely rest of the day. Thank you all. Thank you, my participants, my